I didn't think it would happen to me.
I didn't think it could happen to me, but it did.
I wish I would have taken the time.
I thought it would take too long.
Hello, my name is Todd Chassie and I'm the Medical Director for Kent County EMS. We have been passionate for the past several years about preventing medication errors throughout our region. From our experience in Kent County in the past few years, we have seen over 30 medication errors that could have been avoided. Although the vast majority of these errors haven't resulted in harm, the potential for harm is there. On one side, medication errors can result in long hospital stays and mild adverse reactions, but on the other, it can result in death. Through the course of our investigations into medication errors, it was found that the use of medication cross-check would have avoided the error in the majority of cases. When asked about the use of a cross-check during these investigations, none of the providers took the short amount of time to use it. Here in Region 6, we feel strongly about the use of medication cross-checks and feel it is vital to the safe administration of medications. We would like you to take a moment and watch the following videos. It will depict a situation where the medication cross-check was not used and what could happen. Afterwards, we will show you a demonstration of the proper use of the medication cross-check.
All right, we need epi 1 to 10,000 for cardiac arrest and VFib.
All right. Here you go.
Thank you. All right, epi's in. Hey, Dr. Chassie, do you have a minute to talk?
Hey Clayton, hey Matt, sure, what's up?
So I think we might have accidentally given the wrong medication on that cardiac arrest we brought in.
Really, what happened?
So we were filling out our medication exchange form, and when we were looking through the drug bag, we found that we had an extra epi and that we were missing a calcium chloride. I think we might have accidentally given that instead of epi.
That's interesting. That might explain why the patient was so acidotic. Did you guys do the medication cross-check?
We don't normally do cross-checks on arrests. There's just all the chaos. There's not enough time to get it done.
The medication cross-check is a relatively quick process, and with medication errors being a leading cause of patient harm and death in the healthcare settings, it needs to occur every time. How long do you think the medication cross-check takes?
A minute or two?
Okay, he's in VFib. We need to give epi.
All right. Here you go.
Yeah, thank you. Wait, time out. We need to do a medication cross-check. So I'm going to give epi, 1 to 10,000. I'm going to give 1 milligram through the IV after about 2 minutes during the rhythm check. Can you confirm that for me?
Yeah. So I've got Epi. Oh no, this is calcium chloride. We don't want that. Here's our Epi. So I got Epi, 1 milligram, 10 mLs. There you go.
Thank you. All right, so the epi, 1 milligram, 10 milliliters. Okay, I'm going to push that IV. Epi's in.
As you can see, the medication cross-check is a quick, easy, and painless way to verify the correct dose of medication that you're going to be giving to your patient. Delivery of medications in the pre-hospital setting can sometimes be difficult, with things moving, patients screaming, maybe your partner not driving the nicest, and many other factors. There are a lot of distractions that can take your attention away from the administration of a medication. I think one of the keys to the medication cross-check is that you don't need your partner there to do it. In an ideal situation, we would be able to do a cross-check with someone who is knowledgeable about the medication. But even sharing our cross-check with our patient or saying it out loud during these extenuating circumstances can be an opportunity to prevent an error before it happens. I'm hoping today that we've seen the barrier of time is definitely not a barrier to the medication cross-check. There is always time to cross-check your medication before administering, and I'm hoping that this process will help save our patients from the potential exposure to a medication error. Each and every one of us has an opportunity and a responsibility to participate in the medication cross-check process, to speak up when we see medications not being administered in the correct format, and to help make our system throughout the region the safest medication administration system in the country. I would like to take this opportunity to thank all of our providers who made this video possible, and most importantly, to thank you for watching and learning from our experience.
Thank you.